Hello, my friends. Welcome to the show, Jack Zhao on East West with the G&E TV. It was a while ago we had this chance to talk about diabetes. And it was about a week and a half ago I received a message from a friend of mine. It's a WeChat message, excitedly telling me that the human race has finally conquered diabetes with the solutions through DNA, through cells or whatever, special treatment of some kind. And finally, we are no longer bothered by diabetes. So I called my friend who are in the fields to confirm if this is true. Well, the answer was not that optimistic. So today, at my invitation, my good friend, Dr. Shi, Jim Shi, and the pharmaceutical researcher is here to share his research with us, his findings, or probably we could find not a solution, but definition to my friends who are so excited, and that make me who excited too, right? Okay, now, so Jim, welcome to my show, Dr. Shi.
Thank you, Jack. It's always a pleasure to be here. And I think the topic is very exciting indeed. Yeah. However, I wish when you got message from your friend on WeChat in English language, I hope he was using a future tense rather than a present perfect tense.
Unfortunately, he used the present perfect tense, completion tense. Yeah.
Which is not quite correct.
No,
I should say, because we are approaching the goal, but we are not quite there yet. I guess when people talk about the gene therapy, I guess that's what your WeChat message told you, that diabetes can be cured by gene therapy.
All right.
Now, gene therapy, indeed, it's already in clinical practice, and people started using certain methods, certain biochemical agents to interfere with the genes.
All right.
Now, in this case, I know the research has already reviewed the possibility that you could transfer a gene which makes insulin. So in other words, we know that in our body we have chromosomes, and each chromosome has many genes, and the genes in biochemical sense is made up of the DNA molecules.
I see.
So each protein, such as insulin, which is what's needed for our normal function, normal metabolism, and also used now in treating diabetes patients. Insulin, of course, is based on the gene, based on DNA molecule. In other words, the DNA provides a template. Then the body, the cells are going to use the template and make out insulin molecules.
I see.
Now, because of this is how the cell functions, how the gene functions to produce new molecules.
I see.
So people now endeavor to find out if we can make man-made genes and insert into the human cells.
I see.
Then to make the genes reproduce in insulin.
I see. I see.
So that's a fantastic idea.
Yeah. Well, in other words, the message was not groundless. It has some ground, right? But the ground was only a theory.
The groundwork is now being tested in the animals.
I see.
So everything that before it reaches the human beings as a treatment, it has to be first tested in the cells, in the laboratory, in the test tubes.
I see.
Then if it works, then it's brought to the animal research.
Animal test.
Yeah. For example, the rats and the mice. Although mice are so small, they only feel like maybe just an ounce or even less.
The small one, yes.
Very tiny ones, but they have every organ that human beings have.
Oh.
So then the scientists use typically the rats or mice as a small model to test the theory.
I see.
So,
has it been tested yet?
I believe it has been.
It has been tested.
That's right. And they have used this. But remember this, animals are animals. Lots of times in animal testing, we do maybe a few months, a few weeks. Now it works because insulin is produced, and then they say, now look, we got insulin, and we can we put into humans? Hold on. There's lots of other safety issues to be resolved.
I see.
Because I am in the pharmaceutical industry, and I know the process is long and tedious.
I see.
Very time consuming. The purpose is to ensure safety. When the drug really reaches the human body, you want to make sure it's absolutely safe.
To put it in simple language, though, that everybody on the average understands, it is something defined to use the DNA molecules to be injected to the human molecules, to human cells to produce insulin.
Yes.
Right. The logic, the theory is proven to be positive.
The theory is feasible.
It's feasible.
Is workable.
And on animal tests, which is small lab tests, proven to be somehow working. Okay, now, question is, how far is it normally, judging by years, from the time you finish your animal study to time of starting, utilizing it to human body? How long normally we're talking about?
Typically, let's just forget about insulin. Just let's think of drug development in general.
All right.
From the conception, from the idea to cell testing, animal testing, and human testing, to finally approved by the FDA. It takes somewhere at least 10 years.
Wow.
10 years. But now we are talking about something, a major breakthrough, the gene therapy. We're talking about DNA injection. We're talking about some safety issues that we are not know. We have no idea. We are not known. So now the trouble is testing in certain animals may not tell you everything. For example, certain drugs may be allergic to human beings.
I see.
And we don't know. And there's an additional issue we can further explore. You cannot just inject the DNA. You have to inject the DNA with a vehicle. To
carry it.
Or you would say a carrier.
To carry it.
You have to carry it because you cannot just inject DNA, because if you do that, the cells are going to reject it.
Oh, I see.
So now with the carrier, it involves additional risk. Because the carrier...
Are you talking about robotic? The cell robotic or micro robotic?
No, I'm not sure robotic in your mind represents which physical model, but in essence, DNA injection has to be done by the DNA carried on a virus. Is that scary?
Oh, that's very scary.
No, but we shouldn't be too scared about the viruses in general. We have those pathogenic viruses that cause diseases, but we have those benign viruses. The benign ones, the harmless viruses.
I see.
Because in our body, everyone carries a lot of viruses in our cells.
I see.
So we shouldn't be too scared about this. But at least this is a virus. Once you inject it, it stays in your body, and we don't know the long-term outcome.
I see. So, in other words, we have to make sure that in all aspects, even though it does work on small mice, right, it has to be confirmed to human functions.
Yes.
All areas. For example, what if it does some damage to your language areas, right? For a show host, my whole body might like a rat. Might exactly be the same as a rat, but I can talk. The rat can, right?
Right.
So Well, on him it's all right, but on me it damages my brain cells that is in charge of talking. Could be that effect, right?
Right.
All right, good.
This involves another issue of how do you deliver the DNA? You don't want the DNA to be everywhere, not like you said, you don't want the DNA to be in your brain to produce insulin. Right?
I see.
So that involves another issue of a targeted delivery.
I see.
You want your delivery to reach the target organ.
I see.
Now, in this case, the scientists have tested the liver as a target organ. So when they inject, they have engineered some technology so that the carrier with the DNA, once injected, will go around in circulation and reach the liver and being accepted by the liver, not by the other cells.
I see.
So it has a special kind of a chemical signal carried on a carrier.
Designated for the liver.
Targeting the liver.
Targeting the liver.
Liver specific. So therefore now you have an isolate one carried by a harmless virus. Two, it reaches the liver, it doesn't go to your brain.
You know what is always amazes me? If you take a pill to cure your lung problems, how does the pill know to go to your lung rather than your stomach?
Very interesting question.
Right? And how does it know to go to your stomach rather than going to your toes? Right? So let's take a probably short break. We need some basic education, the looks that we do. So stay with us.